So the students have become more hungry for knowledge. Their aptitude has altered. They need a lot of answers. They are not ready to take anything that you give them. They need a logical reasoning for everything. And the branch also has changed because now we are looking at dentistry not only as dentistry but as a mirror to your entire body.
Hi everyone, welcome to a brand new episode of Toothtalks Navigating Your Dental Journey. Our new series is especially for our undergraduate squad. We bring to you a mouthful of knowledge, a sprinkle of humor, and a whole lot of smiles as you ace through your dental school. I'm your host today, Dr. Soumya, and before we move any further, I would like to thank Cuspyd. They enable us to bring to you this exciting and informative content. Cuspyd is an edutech company that is making efforts to transform the way in which dental professionals learn and grow. So, with Cuspyd, log in for success. So, I say let's start with the basics right from our first year BDS. So, for that, we have with us Dr. Shradha Jaiswal, ma'am. Hi, ma'am.
Hello.
Ma'am has done her MDS and PhD in oral pathology and microbiology from Datta Mege Institute of Medical Sciences, Wardha. Ma'am is currently working as HOD and Professor, Department of Oral Pathology and Microbiology in Sri Aurobindo College of Dentistry, Indore. She is a passionate academician and a gifted speaker. We're glad to have you here, ma'am.
Thank you so much, Soumya. Thank you for your lovely introduction.
Ma'am, to start with, I would like to know how your journey has been as an educator, as a teacher of dental anatomy.
It's been more than 16 years that I've been teaching, and I have realized that there is a massive difference between the student's perception, the student's demands, and also the branch by itself. So the students have become more hungry for knowledge. Their aptitude has altered. They need a lot of answers. They are not ready to take anything that you give them. They need a logical reasoning for everything. And the branch also has changed because now we are looking at dentistry not only as dentistry but as a mirror to your entire body. So the oral cavity is known to be a mirror of your internal system, and that is what everybody is laying stress on. DADH being the base and the first year, DADH forms a platform for understanding all the pathologies that will ultimately affect the human body. So that is why I think DADH is transforming into a different branch altogether.
Yes, ma'am. I totally agree with that. That DADH forms the basis for everything that you're going to do in the future ahead, as even in your practice or anything per se. So, for our viewers who are new to BDS, I would like to say DADH is just a short form of how you would like to call dental anatomy, dental histology, which is the subject as per se. Ma'am, in relation to the same, I would like to know what do you think is the importance of this subject for BDS students, since this is like the first dental subject that they'll be encountering in their entire career, in their journey as a dentist. So how do you think this would lay a foundation for their, practice or their career?
Dental anatomy and histology is the base. So anything that is normal needs to be studied first before we go on to pathology. Dentistry is all about differentiating between what is right, what is wrong, what is good, what is bad, what is normal, what is abnormal. So unless and until you don't understand what is normal, how will you know what is abnormal? And that is why I feel that DADH forms the base for every student. Just like in nursery, you study about the alphabets before you go on to words. Similarly, you have to study about DADH first if you want to go on to any clinical subject or clinical practice.
Yes, ma'am. Very truly said. It's like the ABCD of dentistry. And ma'am, so how do you think can BDS students, how should they approach this subject in such a way that they can relate the knowledge that they gain during the first year into their clinical postings or their future practice?
Till 12th, everybody is into the habit of mugging up things. Here, the scenario changes completely. You need to understand what you are studying. You can't just learn everything and just be done with it, because what you read here in first year is what will be applied in second year. You will need experts of it in third year, and again the same thing gets applied in final year. So that is why learning it, you will not be able to remember. But if you understand it, for understanding, I think videos A lot of animations are very important. Books become a little dry. Teachers try to make it a little interesting, but I think if you can get animations, some 3D concepts like how Cuspyd is doing, I think that will be really nice.
A truly a new approach, I would say, which the Gen Z or the current generation is looking forward to, I believe. So, ma'am, since you're talking about students and how they perceive the knowledge nowadays, so we have a small segment which is called Student Corner, where we have gathered a few questions from our own viewers who are students pursuing BDS or are just going to get started. So, they have asked us a few questions which I'd like to put forward on their behalf. So the most asked question is definitely, why is carving important?
Yes, carving is very important, though it looks very boring. But if you look at the videos that I have done along with collaboration with Cuspyd, you'll realize that they have made carving really so interesting and beautiful. You should take a look at all those videos. So carving is basically understanding the morphology of the tooth. And if you do not know the morphology, when you go into the clinics and you have a patient who has a fractured tooth or maybe who needs a crown, how do you know that the restoration that you're doing is right? It is this dental anatomy which is going to tell you that something is wrong in that patient's smile. And then you will know how to correct it. With good knowledge of dental anatomy, you'll be able to precisely decide what is wrong in the smile and how you can correct.
Yes, ma'am, I totally agree with that. Like the anatomy makes a huge amount of difference in terms of when we do our anterior composite restorations or, smile rehabilitation. Anatomy comes into play a lot because it can just change the way a person is looking. So, ma'am, going ahead, some of our students have asked that can you give us some tips and tricks for the same?
For carving, some tips and tricks, most important is you should look at the picture before you start with the carving. You should read the theory once, because I have seen that students just begin with carving without even knowing the ABCD of the tooth. So you should know how, if you want to draw a tiger, you need to know how a tiger looks like. You can't just imagine a tiger and draw, So if you want to carve a central incisor, a maxillary central, you should know how the central incisor is going to look from all aspects. So knowing the picture, drawing the picture, understanding the dimensions, reading the theory once before you actually begin with carving is very important. And then when you start carving, always carve one side first. What I have noticed is children try to go around the whole tooth at the same time. They want to carve the crown also and the root also and everything. It becomes a complete hayway waste. So they keep wasting a lot of wax blocks in trying to figure that out. Stick to one side, that's the best.
Right, ma'am. That I think is totally a right approach to go with. And I would say you should watch Cuspyd's videos. It is, ma'am has taught it in a very methodical fashion where, you go stepwise. You can pause, you can rewatch, you can take it forward, take it back as many times as you want. Practice with ma'am and I think you'll be good to go. Ma'am, students tend to believe that, say their carving is bad or, they did not do their carvings well in first year. As they go through their clinics, they tend to start believing that their handwork will also be bad. But this might be a misconception, I believe. So I want you to break the myth on this.
Yes, it is an absolute misconception. There is no age for studies. There is no age limit for education. There is no age limit for carving. If you have messed up with your carving in your first year, you always have your final year. You have your internship. You have your clinics to sit and practice your carving. If you don't want to carve on an actual wax block, carve on a tooth. You can add wax onto a tooth and then try to carve it. That is a very good way of practicing it. Because when the children come into first year, they feel their seniors tell them this carving is of no use. This is just waste of time. And that's why automatically they start giving less importance to carving. By the time they come to final year, they realize the mistake that they have done. But it's never too late. You can always practice carving later on.
That is so true, ma'am. It is never too late to learn and learning begins when you decide that it begins. So, ma'am, a lot of students have also wanted to know, like, how do you remember what are the dimensions of the tooth? Because, when they're carving one tooth, it's okay. By the end of first year, they are supposed to remember each and every tooth dimensions because in the exams also, any tooth can be asked to carve. What would your take be on that?
For remembering the dimensions, always remember practice makes a person perfect. So every time you carve, write down the dimensions in front of you. Read it. If you're carving, say, the central incisor and you're going on to the labial surface, Say aloud to yourself that the mesiodistal dimension of maxillary central is so much and the mesiodistal dimension at cervix is so much. So when you keep repeating these things, your mind is ready to accept it. And then gradually over a period of time, it gets embedded into you. Now, do you really have to put in efforts when you read CAT that it is pronounced as cat? No, because it has been imbibed in your brain. So similarly, constant revision again and again is going to imbibe things into your brain.
That is a very practical approach, ma'am. And I think practice is the only...
Yes. That's the mantra.
Yes, ma'am, that's the mantra. Ma'am, coming to another part of dental anatomy, which is oral histology. So what is the best way to remember histology slides?
Read the theory, correlate the theory with the diagram, and correlate that theory and diagram with the slide. Then you will never forget the slides. You're given 3 minutes for spotting. So in that, we say that the first 20 seconds should go for identification maximum. The more you look at the slide, the more you correlate it with the diagram, the more the image gets immersed into your brain. And then just one look at the slide is enough for you to recognize it. So you need to relate theory, diagram and slide together.
Right, ma'am. I think you have to go through your theory through and through to be able to, get your spotters right and get your practicals right.
I would like to add one thing over here. The eyes do not see what the mind does not know. So if your mind knows the theory, your eyes will see it.
Definitely, ma'am. On that note, ma'am, people always want to know how do you differentiate between left and right teeth. So what is your trick for that?
Again, now when we have recorded the carving videos with Cuspyd, I have been very particular in describing the side identification. So I have mentioned a lot of typical features of every tooth. Things that are there on the left, which are not there on the right. So if you remember these things, hold the tooth in the anatomical position, try to locate these little differences that I have talked about. It's very easy to differentiate left from right.
And what about primary from permanent teeth, ma'am? Since that is also, I believe, one of the spotters which comes as an exam question.
Yes. So if you're given one primary, one permanent, very easy to differentiate. But supposing if only one tooth is kept and you need to identify that tooth as to whether it's a primary or a permanent, two important things you must remember. One is that primary teeth are wider mesiodistally as compared to their cervicoincisal length, whereas the permanent teeth usually tend to be longer. Also, the roots of primary teeth are very thin and very flared when compared to the permanent teeth. The rest you'll have to look at the videos and then see further details.
No, yeah, thank you so much, ma'am. That was totally a very apt answer, I would say. And ma'am, this was about how we would deal with the practicals. But when it comes to writing the exams, this would be the first time that the students will be facing a university exam, which is a whole different ball game as compared to what they had in their 10th or say 12th. So what do you think is the best way to present an answer in the exam paper? And like, how do examiners who evaluate those papers, how do they like to see it?
12th is all about filling papers, filling supplements. Dentistry is not. You have to be very precise. You need to write point-wise. Forget writing paragraphs. You need to draw well-labeled diagram, make flowcharts as and when possible. And Cuspyd gives you a lot of notes for that too.
That is true. Cuspyd brings to you an all-in-one package where we have multiple choice questions, notes, easy to draw diagrams. So you should follow Cuspyd for more. Ma'am, I've heard that you conducted a webinar in association with IDA on effective time management. So could you tell our viewers a little bit about how to manage their time as a BDS student, as a first-year student?
First-year students face a lot of issues because they need to manage different subjects. Till 12th, the students are sitting in one class and the teachers are rotating. When you come to the medical segment, you realize that you are supposed to keep rotating. The teachers are sitting in their departments. So there is a lot of change that the students face. And along with that change, taking a depth of a subject which is totally new to them, of which they have not heard about, adds to their misery. So I think managing time is very important. You need to be very meticulous about what is taught and read it the same day. That is the base for mastering dentistry or even MBBS for that matter. Whatever is taught on that day, read it, revise it, re-revise it every week. If you have any doubts, go on to the online videos or lectures that are available. Go to your teachers, don't be scared, ask them your doubts, because unless and until those doubts are cleared, they will just keep adding up. And it will just create a big Everest of doubts for you by the end of the year.
That is so true, ma'am. I think first year forms the basis of all the 4 years. So, it's better to get it done within first year. And the entire transition from school to college is itself a very big journey. So, rather than adding up to it, students should look forward to reducing their burden. And I think teachers are always there to help. So, ma'am, this was all the technical questions that we were going to go ahead with. Now we want to ask you some fun questions. So, this is sort of a small rapid fire. So, I will give you a phrase, and I want you to respond to it with one word. So, dental occlusion.
Grooves and fossas.
Totally. And I think it is the basis of everything that you're going to learn in the future. Pulp chamber.
Pulp stones.
I think you have to follow us for more so that you know what pulp stones are. And ma'am, a fun dental anatomy related mnemonic that you think.
Okay, in dental histology, in the chapter of enamel, we have the life cycle of ameloblast. Yes. So we have those stages of life cycle.
Yes, ma'am, the 6 stages.
Yes, so it is morphogenic, organizing, formative, maturative, protective, and desmolytic.
I never think I can remember those.
So usually, yes. So for that, it is like my old friend, morphogenic, organizing, formative, made pizza dumpling. So,
that is a very interesting one to remember.
Maturative, protective, and desmolytic.
I hope our viewers are jotting all this down. Enamel or dentin or cementum, which is the one tissue that you find most fascinating?
Enamel.
And why so, ma'am?
The outermost covering, pearly white, the first thing that you see when a person smiles.
Definitely, ma'am. And ma'am, one thing I would like to know, what is your mantra for a stress-free dental journey?
Be happy. Enjoy what you're studying. That is most important.
Definitely. If you enjoy, you are in dentistry for the long haul, and if you enjoy, I think it becomes just more pleasurable. Ma'am, do you have any advice or tips for BDS students in how to excel in either dental anatomy or dentistry in general?
Practice, practice, and practice.
That is, I think, truer words have not been spoken. And ma'am, we see a lot of students who are struggling with some complex concepts. So what would you say to them?
Go on to online videos, lot of videos. Dentistry is a topic where many times the subject is very dry. Like in dental anatomy, even in histology, a lot of chapters are very imaginative. You're not able to imagine, like development of tooth. You can't imagine a 3D substance happening inside a person's mouth, So these videos, animations, they do help you a lot. So you can go on to these online videos. Cuspyd has a lot of them. So you can make use of them, and they will actually make it very, very easy for a student to understand.
So that was about the theory exams. But ma'am, what do you think? How should a student approach their Viva exams? Like what is in the practical? There is a part of it, right?
Viva is very different from theory. Many students will realize this, that though they excel very well in the theory, they are just not able to face the Viva. The reason being because the questions that are asked in Viva are very different from what is asked in theory. If you do not know the basics, if the concepts are not clear to you, you will just not be able to answer the Viva. So the best is to prepare for Viva separately. There are specific questions which are asked in Viva. So if you prepare for those specific questions, your Vivas will be a cake for you.
And ma'am, if students, there are some people who get scared when they are faced with an examiner. What do you think? I mean, how can they approach?
Smile to yourself. It lightens up your mood. It relieves all the stress, and you just feel good about it. Then your mind will start working better.
I think being calm and composed,
yes,
and always having a smile is the way to go, I believe. I'm sure Cuspyd is going to ease the burden on all the first year dental students. And with this, we come to a wrap of our exciting show. Thank you so much, ma'am, for your valuable inputs. And I'm sure all our first year students will find it very helpful.
Thank you so much. I'm glad I could be of assistance.
So that wraps up this episode. I hope you enjoyed this session with Dr. Shradha Jaiswal. We will come up with more such exciting content. So comment down below and let us know what you want to see next. Ma'am, this is for you, a small gesture from us. Thank you so much for coming here and giving us your time and helping out our viewers for this.
Thank you so much. Thank you, Soumya. It was a pleasure being with you all.
Guys, that wraps up this episode. Subscribe to Cuspyd's YouTube channel for more such videos. We are going to come up with a lot more interesting content, and comment and let us know what you want to see so that we can bring to you what exactly you want. Also, you should follow Cuspyd's Instagram page, where they put out a lot of great content in terms of how to draw your diagrams or your textbook recommendations and some easy mnemonics and some fun stuff. So you should definitely go check it out.